Good morning and good evening. Yes, today we will be seeing about how to improve the mobility in our knees, how to strengthen the knees. See, this is the question commonly asked by most of the participants. Maithili, I can do all the asanas. But when it comes to Batmasan, I am struggling. It is frustrating for me. Can you suggest some sort of stretches that can relax the muscles in and around the knees so that my movement of leg is so free? So it is not simply when it comes to Batmasan, it's not simply about the muscles in and around the knees, the muscles that are here in your ankles, heel, also in the thighs. So can you suggest some sort of stretches that is so complete so that doing Batmasan is very easy. And most of the participants, other than that, the Batmasan, most of the participants, they suffer with the issues in knee stiffness and knee pain. See what we can do about that. See, when you Google, okay, so YouTube is loaded with lots and lots of videos. They would be suggesting lots of series of instructions. So when you do those kind of instructions, that helps you to easily get into the pose like Batmasan. It's not simply Batmasan, like Batmasan, and also helps to relieve your knee pain and relieve your knee joints, right? But even though they follow those kind of videos, even though they follow those kind of instructions, still they don't get that much result. Okay. Why is it so? Why we are not getting that? So before moving on into that, before finding the answer to those questions, first let us do one experiment. Okay. See, everyone sit comfortably. See, I am not telling everyone. See, if you can easily sit in Suhasan. If you can easily sit in Suhasan, now you friends try doing Padmasan. Just give a try. Take your right leg, put it on your left thigh, and take your left leg, put on your right thigh. See, if you can't do for both legs, just try for one leg. Just try for one leg and assess your flexibility level, how flexible you are, how free it is when you take your leg and bring it towards your abdomen, whether it is free or not, whether you can easily able to lift your leg. Have you assessed? Yes? Now, okay. Now relax yourself. Relax your legs. Yes. Now just keep your hands in this mudra. See, observe. See, observe, ma. See, observe. So this is my left hand. Okay. The left thumb is touching the tip of middle two fingers. Okay. So this is my right. The right thumb is touching the first two fingers. Got it? Yes. The left thumb is touching the tip of middle two fingers. The right thumb is touching the first two fingers. Okay. You got this mudra? Yes. Keep your hands in this mudra. Now close your eye. Close your eye. Now take your attention into this area, the place below your diaphragm and up to the place in and around your navel area. Okay, keep your hands in this mudra. Close your eyes. Just take deep, just take deep inhalation and exhalation, focusing in your upper abdominal area. Start. 3 minutes. Gently open the eye. Release the mudra. Move your finger. Yes. Now let's try again. Try doing Padmasana again. Just give a try and assess your freeness, mobility, flexibility level, whether you can do it easily. Take your right leg, place it on your left thigh. Take the other leg. Just assess the movement of leg. If you can't do Padmasana, no worries. Just assess the movement of leg. Whether it is free, your leg can move freely. Yes, share your experience with me. Even you can do for one leg, single leg also, that is fine. Share your experience.
Can do only one leg, Maithili. The second leg is not good.
Oh, but that's okay. But you when you compare to the previously you
Very,
did know,
yeah, very good, very good.
very good.
Couldn't do before, but after doing the mudra, it was good.
Yes,
It's a
yes.
little, it's a little flexible.
It's little bit flexible. Yes. Manjula
Yes.
சொல்லுங்க.
ஒன் லெக் தான் இப்பயும் பண்ண முடியுது எனக்கு மேபி
That's okay. அதாவது previous வெர்ஷனை விட இப்ப எப்படி இருக்கு?
இப்ப இப்ப கொஞ்சம் அந்த ஒன் லெக்கே இன்னும் கொஞ்சம் உள்ள நம்மளோட தை கிட்ட இன்னும் கொஞ்சம் நெருக்கமா எடுக்க முடியும்.
Yes, 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 yes. Good, Manjula. Mute yourself. Any other want to share your experience?
Actually, I have a pain in my left leg. So normally I used to put my right leg only during Padmasana. Now I'm able to, put both the legs.
Good. Super. Nice, Chandrakala. Tripura Sundarika சொல்லுங்க.
மைதிலி முதல்லாம் அந்த ரைட் லெக் மட்டும் போட வரும். இது தூக்கவே வராது. இப்ப நல்லா ஓரளவு நான் மேல தூக்கி வச்சுக்கிட்டேன் கால.
ஓகே, சூப்பர் அக்கா, சூப்பர்.
என்ன முத்ரா மைதிலி? இது அப்பான முத்ரா, இது
சொல்றேன் அக்கா, சொல்றேன் அக்கா. Yes. Any others? Okay. So what we have done, we have done only the mudra, right? See, what is the connection between the mudra and the knees? The knees are here. Okay. We haven't touched any of the muscles in and around the knees. We are simply we're keeping our fingers in a Saturn position, and we have simply focused on our breath only. The simple breathing, how it can bring flexibility in the knees, because the flexibility in the knees depends upon various factors. So much of factors. Okay, so let us see about those factors one by one. First one, this place mostly relates to digestion. If your digestion is good, then the movement of knee would be good. Okay. See, you may think that what you are saying, digestion happens here. What is the connection between the your tummy and also the knee? The energy channels that carry the prana sakti to the organs that relates to the digestion have so much of pressure points in and around your knees. Okay, so if your digestion is poor, that leads to the stagnation of prana sakti in that area. That will result in the knee stiffness, knee pain, or some kind of spasm around your knees. Got it? That is the first factor. Then the next factor is your sleep. If you are not sleeping well at night, please note it down. The nighttime sleep is much important. It is not simply about you are sleeping in the morning, from the morning time till morning 6 o'clock to the noon 11 o'clock, you are sleeping. That sleep is not going to be counted at all. It is about how you are sleeping at night. If you are sleeping at night, then the knee health would be good. You have to sleep around 10:30. Right? If you are doing so, then the quality of sleep is good, then your knees will be good. Right? Then the third thing, what you do with the leg. What we do with the leg? What the leg is for? What we do? We simply move around. Okay, we simply walk and move around. See, now tell me which emotion that holds you back or that makes you stay still. Which emotion? Is it your sadness? Is it your anger? Which emotion? Tell me. Yes,
Fear.
Shilpi? Yeah, good. Fear. Okay, so if it is said that they are frozen in fear, we won't say that they are frozen in anger. We won't say that they are frozen in grief. We say that frozen in fear. So fear is the worst kind of emotion that makes you immobile. So what triggers the fear in the mind? It is the insecurity, some sort of insecurity. You are insecure about the relationship. You are insecure about your job. You are insecure about the outcome of the studies, your kids' studies. You are insecure about the future you are going to have. So if there is all the time you're insecure about your health condition, okay. So if you're all the time carrying some sort of insecurity in your mind, that is going to be a fear, and this fear, it's going to immobilize you, and it will happen only particularly in the knees and also in the ankles. Some people may ask, see, my ankle is not moving enough. I have a problem with this ligament. I have a problem with these muscles. Even though I do all sort of stretches, it is not going to be relaxed. If we are continuously unconsciously carrying the fear all the time, then again, it is going to immobilize us people. See, observe, we are more than muscles and bones. We are more than these kinds of muscles, bones, and ligaments and tendons. Right? Okay, this is the third factor. The first one is digestion. The next one is sleep. The third one is fear. Then the fourth one is water metabolism. Okay, if your body is digesting the water good, what is this? You are digesting the water good. So it means that whether your body is making completely use of the water you are drinking. See, for example, you are drinking the water. Within 10 minutes of time, that water is coming as output. That is, you are urinating. As soon as you drink water, within 5 to 10 minutes, you have to urinate. Frequent urination complaint. See, it means that the water you are drinking is not efficiently used by the body. You are inputting, but the processing is not happening here. So, the whatever that is inputted coming as output without no processing, right? So it has to be efficiently used by the body. The water you are drinking, it has to reach each and every cells of the body. That is one thing, right? Then the next thing, it is all about losing your identity. Okay, if you feel like, again, the fear factor comes, the insecurity factor comes, okay, but particularly if you feel like losing your identity, for example, you have some issue, okay, issue with your husband, okay, you are telling the husband continuously, but he is not listening at all. You are telling your wife continuously, don't do this, don't, but they are not listening at all over certain issue. In such a case, sometimes at one particular point of time, we may have feel that what is it, this is a very important issue, I am telling him or her, but still she is not listening. Then what is the point? See, I feel like whether am I the wife or am I the husband, still they are not listening anything to me. So if you feel like losing your identity, so mostly the elderly people would be facing the problem. So when the kids are grown up, what happens now? The kids would be flying away. Okay, they won't listen to their parents. So the parents would be having a feel in their mind. Okay, they are all grown up. They don't need me much. Then it means that they feel how they will have a feel of losing their identity as parents. They don't need me. They don't call me. If and only if I call, they are talking to me, but they won't call all by themselves, right? So in such a case, fear of losing the identity, okay, it is going to happen. Then the next thing, it's about the food you are having. It is about the food you are having. Yes, yes, everything is necessary for our body. Okay, it is not simply a particularly one thing. So if you are eating too much of protein, too much of protein, yes, protein is absolutely necessary for the body. But if you thrive more on protein, all the time eating the chicken diet, or all the time you are having the sprouts, okay, all the time you are having the paneer, so that because it is good for muscles, again it is going to hurt your joints. And too much, too little of fat, too little of fat. If you're not taking any fat at all, you're not touching, the good fat is necessary for our body too. You're not simply touching, oh my, I won't touch that because if I eat all those things, oh, I won't eat the coconut. If I eat the coconut, I will put on weight. So good fat is available in all those resources. Okay, if we are not touching, if we are staying away from all those kind of things, again, it is going to affect that one. Okay, and carbohydrate. Carbohydrate is also necessary for our body, right? See, carbohydrate, the food, everything belongs to earth element. Carbohydrate and food, everything belongs to earth element. See, the earth is here. Okay, the earth is here. I am standing more safe and securely on this earth. Okay, see, for example, the earth is slipping away. The earth is slipping away. There is no earth under my feet. So what I would be doing? I would be wobbling. Oh my, nothing to stand on. I may fall down. Okay, so I will wobble, right? So the same thing happens in my mind. The food is of earth element. Okay, so if you eat very much little, intermittent fasting is good. But if you are eating this much only, in order to maintain your physique, in order to maintain, that is what to say. So reduce the weight, you feel that I will get obese. So you will all the time controlling yourself, disciplining, over disciplining, much disciplining yourself, and you are eating this much only, you are not taking enough carbohydrates and enough fat, then that time also what happens now, it is going to indirectly affect our mind also. So we will end up in some sort of insecurities and fear. Again, that is going to hurt our knees only. Okay, so what we can do with this? So the flexibility of the knee depends on all these factors. The flexibility of the knee, the health of the knee, the strength of the knee depends on all these factors. So just check which category you belong to. Okay, see whether you are sleeping well. Okay, whether your digestion is good. Okay, whether your water metabolism is good, or you're having some sort of fear or insecurity. Do you feel like losing your identity? And are you taking much protein, too less carbohydrate, very little fat? Just check. And which category you fall into, you have to focus on that. Okay, yes. So first, in the start of the session, we have done one mudra, right? So what this mudra? That mudra is called Pushan mudra. Pushan mudra. Pushan mudra, Tripura Sundarika. Yes, see what this Pushan mudra is for? This Pushan mudra takes care of your digestion. It takes care of the digestion from your oral cavity to your anal cavity. From here to here, it would be taken care of everything. Okay, so when we keep our hands in this Pushan mudra, it takes care of your digestive glands like liver, spleen, pancreas, gallbladder, small intestine, everything. Got it? So what happens now when you keep your hands in this mudra? The prana sakti to those organs will be sent sufficiently. So if there is any blockages happening in the energy points or energy channels that carry those prana sakti to those organs, those will be getting cleared off. That is why when you keep your hands in this Pushan Mudra, after doing Pushan Mudra, when you move your legs, you feel like moving it free. Yesterday's session, one lady attended. She is of 70 plus. What she said, Maithili, I couldn't do Padmasana. But when you first asked me, I simply stretched the leg only. I couldn't move my leg at all. But see now, see, just she sat like this. First, initially, I sat like this. When you asked to check, I couldn't lift my leg at all, Maithili. But after doing this mudra, see, I can move this leg. She was so happy. The people are like that. Even bending of the knee is becoming a very happy thing for them. So even I myself also felt happy. But just by seeing that old lady becoming very happy, right? So see what I am telling to what I am coming to say. This one relates to your digestion. So if you want to improve the digestion, yes, of course, you people know lots and so many things are there. But when it comes to mudra science, the mudra that you can do is Pushan mudra. Okay, so push and mudra takes care of all the digestive glands. Other than this, if you are suffering from diabetes complaint, okay, if you are suffering from flatulence, if you are suffering from bloating issues, right, ulcer compliance, and your elimination is not good, partial elimination, you are suffering from the problems like constipation or irritable bowel syndrome, yes, you can regularly practice this push and mudra. Yes, but there are some certain restrictions while practicing the mudra. That is, when you practice the mudra, your abdomen has to be empty. But this Pushan mudra is exceptional. You can practice it immediately after your meal. Okay, you're going out for dinner, you're having a great food. Okay, you're full with your abdomen and your mind. Oh, good. Yes, but you feel like stuffing. Oh my, in happiness, I have eaten so much. Oh, this much here, the food is here. Okay, you can try Pusan Mudra. So within 5 minutes, you can feel the freeness in your chest and in your abdominal area. Got it? But don't try Pushan Mudra when you are going to bed. So it is going to energize your system. So you won't get good sleep. You won't fall into good sleep. Okay. That is the one thing. Then the next thing about the water metabolism in the body. Okay, see how I'm drinking enough water. I'm drinking daily. I will be drinking 3 liters of water, 4 liters of water, but still my body is not taking much water. So what I can do? See, just bring this one lifestyle. Just bring this one lifestyle. That is drinking water. The first dose of water in the morning, it has to be drunk in a gulp fastly. It has to clean your internal system. Then after that, you have to drink the water sip by sip by sip by sip, just like how you enjoy the cup of coffee or tea. In the lifestyle classes, we would be seeing that one, right? I am giving the same analogy. See, I have the bucket of water. Okay, throw that bucket of water into the ground. All the water would be running away. Okay, so our body is also just like the earth or the ground. Whereas you take a glass of water, just pour the water drip by drip, drip by drop by drop, drop by drop into the ground. No drop would be flowing away or running away. Everything would be seeping into the ground. The same way, when you drink the water sip by sip by sip, the water metabolism would be good. Just try this one lifestyle. It brings so much of different in your knees. Okay, then the next thing, the one, yes, the one that takes care of your water metabolism is the points that are behind your knees. That is why when you practice the asana, keep your legs straight, keep your knees straight, don't bend the knee, don't bend the knee. See, it is not simply, the asana is not simply about working on your physical body. It is also about working on your pressure points. When we practice asana and pranayama on the regular basis, what happens now when you practice the asana and pranayama, you are going to clear the blockages happening in those pressure points. So it is therapeutic. Okay, so we need not go to that, it is not like unnecessarily, right? It is like daily you are getting a dose from an acupuncturist or a Varma therapist, just clearing your own blockages happening in your body. When you practice asana, you are becoming the healer of your own self. You are becoming clearing all the blockages. So the points that are behind your knees, it helps to improve the water metabolism. That is why while practicing asana, I ask you to don't try to reach for the ground. Try to keep your knee straight. Okay, when you feel the stretches at the back of your knee, it is going to improve the water metabolism and also it helps to take care of your knee. If you are not drinking enough water, what your body would be doing now? Your body would be drawing water from whichever places it is necessary. See, our body is made out of 70% of water, right? You are not drinking enough water. Now, water is necessary for our body for most of the purpose, for cleaning, digestion, assimilation, metabolism, everything. So what our body would be doing now, it would be drawing the water wherever it is available. So particularly it would be drawing from the knees. Synovial fluid secretion is not there, ma. If you go to the ortho doctor, they would be telling like that. Physiotherapist would be telling like that. And it would be drawing the water from here also. There would be a padding between the padding, cartilages between the two spinal vertebrae. From there also it would be drawing. So if you are not drinking enough water, it happens now, you may end up in knee issues, also your back pain complaint. So ensure that you are having enough water. It's not about how much liter of water you drink. It is all about listening to your thirst. Just listen to your thirst. If you feel thirsty, just drink water. That's it. Then the next thing, see, if you drink water like this, if the glass is not touching your leg, it's going to be hygienic. Okay. But when you do so, what happens now? All the water directly goes inside your this place. Okay, your food pipe. But if you drink water like this is not hygienic. But if you drink that, you will drink slowly. And the water you are drinking, it would be mixing with saliva. Okay, it would be going inside. So water digestion would be good. So I suggest don't drink water like this. Drink water or juice by sipping only. So that is the best way of drinking. Okay, yes. Then when it comes to the sleep, okay, sleep, yes, in the lifestyle class itself, we have seen so much about sleep. See, what we should do to ensure the quality sleep, staying in darkness, everything we have seen. So now this session is all about take the mudra signs. Okay, so what you can do if you are not getting the sleep. So the mudra that you can do is Prithvi mudra. The thumb is touching the tip of the ring finger. Thumb is touching the tip of the ring finger. This is Prithvi mudra. Okay. So Prithvi, what do you mean by Prithvi? Prithvi means earth, earth element. You are bringing the earth element into your body. You are balancing the earth element into your body. See what I told you, see how beautifully it is getting correlated. I told you, no, if the earth is slipping away from your body, you will have sort of insecurity. You will be feeling like wobbling up. That happens in your mind also. Yes, so you need proper earth element to feel more secured, so that your knees are also stronger. So in this mudra, you are bringing or you are balancing the earth element in your body and also in your mind. Okay, so anyone can practice this. So if you are suffering from obesity complaint, you can practice this to maintain your optimal weight. If you are so thin, you feel like, oh my, I feel like putting some more weight. My cheeks are so, it's not that much chubby. I'm not looking great. So you can practice Prithvi Mudra. Yes, it helps to increase the weight also. So it is all about balancing how much weight it is required for the height, that much weight this Prithvi Mudra. Other than that, this Prithvi Mudra helps to take care of our skin, hair and nail. This Prithvi Mudra takes care of tendons and ligaments in our body. Got it? Yes. See, as what we have seen, the night time is for your liver. In lifestyle class itself, we have seen. Okay. And the organ liver takes care of, according to acupuncture terminology, the liver takes care of your muscles and tendons. If you are not sleeping enough at night time, if you are not sleeping enough, if you are not good, your quality of sleep is not good at night time, you are more prone to ligament tear. You are simply walking. I have twisted my ankles like this. Then they are saying that it is a ligament tear. Why is it happening? Because if your sleep is not good at night, the ligaments and tendons would be very, it won't be healthy at all. Right? So the quality of sleep should be good. And this mudra takes care of your sleep. It takes care of your tendons and ligaments, everything. Right? Then the next mudra that we will be seeing is Vayu mudra. See, fold your index finger and place your thumb over that. This is Vayu Mudra. This mudra also we have already seen in the class.
Prithvi Mudra can be done anytime, or how is it so?
Yes, sir. Anytime. இல்ல ஒரு சாப்பாடு சாப்பிட்டு கொஞ்சம் கேப் இருக்கலாம் சார். சாப்பாடு சாப்பிட்டு. So after eating, there is a little gap. Okay. And this Vayu Mudra also. See, this is Vayu Mudra. Okay. See, what is the functionality of Vayu Mudra? See, whichever thing that relates to the air element or the joints, you are having stiff joints, stiff knees, okay, and your hair is very dry, split ends are there, okay, lots of things going on in the mind. So your mind is all the time racing. It is not staying in one place. You are not getting enough sleep. That time also you can try Vayu Mudra. So this Prithvi Mudra and Vayu Mudra, yes, of course, the common rules follows. After the food, heavy food, leave a gap of almost 2 hours. Then you can practice. I suggest daily night. You people have seen, no, in the class we will be having Prithvi Mudra and Vayu Mudra in Savasan, right? See, after 3 minutes, if I ask you people to come out of the pose, you won't be feeling like coming out of Savasana. You will be feeling like continuing it for some more time, right? So it gives you good sleep. So what you can do now, you can have your hands in Prithvi Mudra and go to sleep at night time. Keep your hands in Vayu Mudra and go to sleep. So that will ensure the good deep sleep. Okay, so that time you can practice. You need not devote a separate time for doing this mudra, right? Then when it comes to then the insecurity. Okay, the insecurity in our mind, you are all the time carrying some sort of fear in the mind. See, yes, we have to work on lots of aspect. Yes, it is not simply about do the breathing, do the mudra. Yes, of course, we have to work in the society also. That also we have to do. Okay, but when it comes to mudra science, we can have two mudras, right? See, lots of mudras are there. So these two mudras works good. See, everyone sit comfortably before trying the stretches. And seeing about the pressure points, let us see about the mudra. It is called Abhaya Mudra. Okay. See, the right hand should be up like this. That's it. Okay. See, this left hand can be simply kept free, or you can keep your left hand before your navel like this. Shall we try it for 2 minutes? It would be good. Yes. Now what you do now, just close your eyes. Just visualize that you have to make conscious breathing, and you have to visualize that you are getting the energy from the universe, golden energy, something like that, energy from the universe through your crown. And whichever thing you are fearing of, okay, நம்மளுக்கு எதுல பயம் இருக்கு, எதுல. So you feel like projecting the energy that you got from the universe out through the palm into that thing. For example, you are fearing about the exam, okay, passing in that exam. So just visualize that the energy is projected over the exam like that. If you feel like, no, I don't want any kind of visualization, then that is fine also. Simply keep your hands like this, keep your eye closed, and make deep inhalation and exhalation. That serves the purpose. Yes, start. 2 minutes.
என்ன முத்திரப்பா வைக்கணும்?
அபய முத்ரா. கையை சும்மா இப்படி வைங்க. கையை சும்மா இப்படி தூக்கி.
இல்ல பெருவிரல் இதா அப்படியா?
பெருவிரல் இல்ல, இந்த இருக்கு பாருங்க, இப்படி
விட்டு விட்டு கேக்குது, எனக்கு சரியா கேட்க மாட்டேங்குது.
ஒருக்க லாக் ஆஃப் பண்ணிட்டு லாகின் பண்ணுங்க. இவ்வளவுதான். கையை சும்மா உள்ளங்கையை இப்படி வைக்கணும், அவ்வளவுதான். Yes, relax. Relax yourself. Move your fingers. How are you feeling? Yes? Good. Now we move on to the next mudra. Okay, this is also for fear. See, just interlace your finger loosely. Don't keep it tightly. Just loosely interlace. Just have it before your chest. Again, close your eye. Make deep inhalation and exhalation. This is called Vajra Pradama Mudra. Okay. Yes. Shall we move on? And you have to say me, get back to me, how you are feeling here after doing this mudra. Okay. 3 minutes. Start. Deep inhalation and exhalation. Focus in your thoracic area or the place over your heart. Yes. Now gently open the eye. Relax. How you are feeling here. Share your experience.
Yeah, Maithili.
Very light
Actually,
and
yeah,
Mm, mm,
I'm feeling inhalation part is very little low, but
mm,
exhalation I'm feeling more part. I mean, more time I'm exhalating.
mm,
I
mm,
feel that one.
mm. Good.
Maithili,
Good. Yes, Charmati.
very light on heart.
Very
The
light on
heaviness,
heart.
uh, heaviness
Yes,
has reduced.
ஆமா
yes.
சேம் அதேதான் ஒரு மாதிரி ஹெவியா இருந்தது இப்ப ரொம்ப லைட் ஆன மாதிரி ஆயிடுச்சு.
Good. So when you are suddenly encountering a fear, so which part of the body is getting flashed out? Just like a panic attack, It will come here. From here, right? See, whichever things you are holding, it stores here, right? When you do Vajra Pradama Mudra, whatever you are holding unnecessarily, that would be going away. Okay. Then the next thing, it helps to promote the circulation also. Circulation all over your body. So that's why you're feeling like something is free. Something is so light from here. Okay, see, it doesn't mean that if you do the mudra, all the problems will be going away. Chu mantra kali, everything goes off. It's not like that. The problems will be there, and we won't be like, after doing the mudra, we won't be like Bahubali lifting some heavy things, something like that. We are so brave, but it helps for us. You are seeing, no? You are seeing it all by yourself. After simply within 2 minutes, you have done. You feel some sort of freeness in the chest area, right? So like that, it happens. So the way you respond to the problem, how you react to the problem, it differs. Based on that, following actions will also be decided. How we respond, how we react. Yes. So this mudra. Okay. Yes. Now let us move on to this. So what we have seen about that Pushan mudra, Prithvi mudra, Vayu mudra, then this Vajra Pradama Mudra and Abhaya Mudra. Got it? Now let us move on to the pressure points before moving on to the stretches. Okay.
Madam,
சொல்லுங்க.
Pushan Mudra மட்டும் காட்டுங்க. Pushan Mudra.
நான் குரூப்லயே உங்களுக்கு போட்டு வரேன் சார். உங்களுக்கு எல்லாமே வந்துரும். நீங்க டோன்ட் வரி. இத இருக்கு பாத்தீங்களா? பூஷன் முத்ரா வந்து இது. தம்ப் வந்து லெஃப்ட் ஹேண்ட்ல வந்து தம்ப் இஸ் டச்சிங் த மிடில் டூ ஃபிங்கர். அப்பான முத்ரா கையில வைக்கிறோம். ஓகேவா? ரைட் ஹேண்ட்ல வந்து ஃபர்ஸ்ட் டூ ஃபிங்கர்ஸ் கையில வைக்கிறோம். அவ்வளவு. நான் குரூப்ல போட்டு வரேன். ஓகேவா? So you can name it to be the diabetes mudra. என்ன மாதிரியான digestion issue இருக்கு அப்படினாலும் you can do it. Okay? Yes. Yes, friends. See, observe. Before moving on to the stretches, we try these points. Okay? See, which are the points that helps with free mobility of our legs. Okay? See, when it comes to Padmasan, see what are the muscles that are involved. So it is our quadriceps, hamstring, the muscles on the sides, abductor, adductors, everything, and the muscles in your gluteal area, right? And also your calf muscles and some part of your ankles when it comes to Padmasan. Ankles as well as your heel. Everything comes. Okay. Now, so just have it in mind. Now let us see about the pressure points. Whichever pressure points that improve the flexibility. Right? Yes. See, everyone, please first observe. Then you also have to do with me. See, observe. Let us start from here. So the place where your butt joins with the thigh. This place, the midpoint. The place where your butt joins with the thighs, this midpoint. Okay. Then the next point is middle of the thigh. This place here. Just middle of the thighs. Okay. Then the next point is, let us see at the back first. Then the next point is just below your knee. Okay. So the mid of the knee at the back and also the sides. Also the sides at the back. The mid of the knee also the sides. Okay. Then comes the mid of the calf muscle. Mid of the calf muscle. Right? And this bone is called the outer malleolus. This bone is called inner malleolus. Kanakal Pavdi. So the point that is below your malleolus bone, it is very much important. On either sides it is important. And also this ankle part. You can just give pressure like this. These points for digestion. And also this place. And how you can go now? You can also just give massage to the head of the toes and also to the web of the toes. Okay. Then the next point is you rest your palm over the knees. Rest your palm over the knees. Okay. Now the place where the index finger ends and the place where the ring finger ends. Very important points. The place where the index finger ends and ring finger ends. These are also the important points. And this is my kneecap. This is my kneecap. Okay. So the top corner of the kneecap also over. The place in and around kneecap, it's surrounded by so much of energy points. You can give like this also. Right? Yes. Now everyone do along with me. Take one leg so that you can see the difference for the other leg. how freely it is. Everyone, whether you can sit also, you can sit and do also. Do along with me. Everyone take one leg. Yes, start. Only for one leg you do. Then only you can see the difference. See, first one is your gluteal area where it starts, it meets with the thighs. The midpoint. The midpoint. Just give firm pressure. Give firm pressure. Just pressure.
Maithili, is it the tailbone end?
No, not the tailbone. So this is our palm. Okay, the palm joins with the thighs. No, this place. The place where you sit. It's not the tailbone. The tailbone is here.
25. Correct?
Yes, 25. Right. 25. Good.
Okay,
Super. Okay, 25. Yes. So, got it? Yes. Now, take your thighs. The midpoint of the thigh. Midpoint of the thigh. Give pressure. Firm pressure. These places you can give nice pressure. No worries. Mid of the thigh. Okay. Yes. Now, below the knee. Below the knee. Then sides of the knees. Sides. Sides of the knee. Give firm pressure. Yes. Mid of the calf muscle. Mid of the calf muscle. Very much important. You can give firm pressure. Firm pressure. Yes. On either sides of the malleolus bones. Not firm pressure. Mild pressure. Don't give too much pressure. Mild pressure. Either sides of the malleolus bone. கணுக்கால் மூட்டு பகுதிக்கு sides ல இருக்கிறது. Yes. The top of your foot. The top of your foot. Midpoint. Mid of your foot. All the webs. Toe web. விரல் இடுக்குகள் எல்லாத்தையும் மசாஜ் கொடுங்க. You can give firm pressure. And give nice massage to the top of your toes. Toes, top of the toes, head of the toes. Just give massage. You did now? Yes, now come to the knee. Come to the knee, just give, this is your kneecap. Just give light pressure to the places in and around your kneecap. Now have the palm over the knee. நம்மளுடைய உள்ளங்கை அப்படியே kneecap மேல வைங்க, முழங்கால் மேல வைங்க. The place where your index finger ends and the ring finger ends. அந்த ரெண்டு பாயிண்ட்ஸையும் நல்லா பிரஷர் கொடுங்க. firm pressure. கையை இப்படி வைக்கிறப்ப okay, respective hands in respective legs. Right hand na right leg மேல வைக்கணும். Left hand na left leg மேல. The place where the index finger and ring finger meets. Yes. Relax. Now see the difference in one leg in another leg. Which leg is free? Which leg? Yes?
Right leg, which we did massage.
Massage. You feel the freeness, right?
Yeah,
so when
yeah.
you do the, yes, Chapani
Very
Srinivas.
light,
It's lighter than the
has become very
left
light.
one.
Yes, good. So what we are doing by activating the pressure points, what we have done, we have released the blockages happening in those points. Happening in those points, we have released. So you are feeling the freeness in your body. It is not simply about relaxing the muscles. Okay, right. One kind of stretch that we do in the class. One kind of stretch that we do in the class that activate all these pressure points. We do it commonly. Everything will be getting activated. And the things that are involved, that is quadriceps muscles, hamstring muscles, lateral sides, that is gluteal, this pressure point, the place around your gluteal area, sides, everything is nothing but Supta Pada Angusta Asana. Suptapada Angustasana. Let us try and see all by ourselves. Everyone take the rope. Take the rope. Get it? You have known the pressure points, no? So today, when you do it, it would be very easy to understand how it works. And see, friends, if you have the issues with this place, okay, some people may be having the issues here in the ankles. See, this ankle place is full of digestion and also the things that keep your mind calm. Okay, so if you have some sort of stiffness happening in the ankles, ensure that your digestion is good. Then the next thing, also see that whether your mind is calm, your mind is not a racing mind, overreacting mind. All the time it is full with lots of stuffs. In such a case also, that place is going to not, it's not going to relax even though we do lots of stretches. Okay, so what I can do now, you can do this feet up and down, side to side movement, back to back movement, like that you can do. You can do Vajrasan, like that kind of thing. You can do Veerasan kind of things. Those things helps to relax your ankles also. Yes, now let us try these stretches. Everyone lie down and see yourself how the pressure points are getting activated. Lie down. Yes, now put the rope over your right leg. Put the rope over your right leg. Yes, everyone. Now slowly exhale, lift the leg to 90 degree. Yes, again, what you have to do? Your knee should be straight. Don't bend the knee. Why I'm telling? If and only if you keep the knee straight, the back of your knee will be feeling the stretching. So that place is for the pressure points that improve the water metabolism. Okay, and observe your thighs. Feel your calf muscle. Feel the stretch happening there. If you don't feel that much of stretch, even though you're keeping your leg in 90 degree, pull it towards your body some more. Pull your leg towards the body some more, so that you feel enough stretch. Knee straight. If your knees are bent like this, just have your hand over the knee, push it back. Okay, now slowly inhale, bring the leg down to the ground, to the same side. Okay, see, if you have difficulty, ஷாலினி அதே சைடு கீழே இறக்கணும். கால் அப்படி கீழே இறக்க கூடாது. ரைட் சைட் பண்றீங்க அப்படின்னா ரைட் சைட் கீழே இறக்கணும். See, if you have difficulty in bringing the knee to the ground, you can rest your leg on the cushion like this. Like this also. Based on your flexibility level, you can have 1 cushion, 2 cushion or 3 cushion. It is up to you. But the thing is, you are not supposed to bend the knee. Your leg has to be straight. Observe the sides of the thighs this time. That adductor and abductor muscles. Observe them. Lateral sides of the thighs. Feel it. Feel your quadriceps and also your hamstring. Feel your knees. Feel your calf muscle. Now again slowly lift the leg to 90 degree by exhaling. Up, up, knee straight. Now slowly exhale, bring the leg to the opposite side and turn your neck and hand to the other side. Again, if you have difficulty in keeping your leg on the ground, you can rest it on the pillow or cushion. Turn the neck to the opposite side. Now feel the sides of your thighs, lateral sides. Observe the groin part, the quadriceps, hamstrings, everything. Knee should be straight, don't bend the knee. Now again slowly inhale, lift up 90 degree. திவ்யா கண்டிப்பா ரோப் யூஸ் பண்ணணுமா? நான் தான் அந்த எஃபெக்ட் தெரியும். நம்மளுக்கு நல்ல ஃபிளெக்சிபிலிட்டி இருக்கும், பட் ஸ்டில் நம்ம யூஸ் பண்றப்பதான் நம்மளால உணர்ந்து பார்க்க முடியும். Yes, now slowly inhale, come out of the pose. Relax. Feel your leg. Feel your thigh. Calf muscles, your foot, ankles, lower abdomen, pubic area, observe. Yes. You feel like lying down, right? Continuing this posture, right? So this asana makes us sedative. Change the rope to the other side. Change the rope to the other side. Now lift the leg to 90 degree. Again, knee should be straight. Why you don't feel like, after finishing this asana, why you feel like sedative? Because all sort of fear, insecurities, everything is stored in your pelvic area. When you do this asana, the pelvic area is nourished by fresh supply of blood and prana sakti. That is why you feel sedative. It helps, it heals you from inside. So this is the pose for insomnia also. I told you, no, if you can't get into Padmasana, just to see that whether you are sleeping well or not. When you do this pose, it works for your sleep also. Helps to address the psychological disorders also. Yes, now slowly inhale, bring the leg down to one side. Again, knees straight. Observe all the pressure points we have manipulated. Are you feeling some sort of stretches happening there? And all the muscles that are involved in getting into Padmasana, or the muscles that are involved with the mobility of the knees. Just feel the knees, the tendons and ligaments that support the knee also get strengthened up in these stretches. Yes. Now slowly lift up to 90-degree again. Knee should be straight. Now slowly exhale, bring the leg down to the opposite side. Turn the neck to the other side. Again, if you wish, you can make use of the rope. You can make use of the cushion or yoga block to rest your foot on the ground. Now again, inhale, lift the leg to 90-degree. Again, observe everything. Hamstrings, lateral sides of thighs, quadriceps, groin part, the place where the butt joins with the thighs, back of the knee, over the knee. Yes. Now slowly inhale, come out of the pose. Relax. Feel your thighs, knees, calf muscle, foot. Don't simply observe the leg you have done now. Observe the other leg also. You have worked on this leg only now this time, but you can see the difference on the other leg also. Yes. Now to see the effect of Prithvi Mudra, lie down, don't rise up. Keep your hands in Prithvi Mudra. The thumb is touching the tip of the ring finger. Thumb is touching tip of ring finger. Lie down more relaxedly for 2 minutes. I will alert you after 2 minutes. Prithvi Mudra.
Maithili, I need to leave now.
No, no
Thank
worry,
you
no
so
worry.
much. Yeah.
Lie down, Durga Prasad garu, lie down. Hands ni Prithvi Mudra lo pattukoni, lie down చేయండి. Yes. Now slowly release the mudra. Move your finger. Move your hands. Move your leg. Now turn and lie on your right side. Inhale, please rise up slowly. How are you feeling? Don't feel like getting up, right? Yes? See how sedative these stretches are. See, it makes your mind more calm and peace because it works deep from inside. It clears out the blockages, all the emotional and psychological blockages. So practicing asanas, pranayamas, you're giving a daily dose to the body, just like how you brush the teeth, just like how you are bathing. You are cleaning the body externally. When you practice asanas, when you practice pranayama mudra, it is like cleaning the body internally on a regular basis, doing the meditation, right? So have you observed, no? This one kind of stretch, it is working here, it is working here, it is working at the back, it is working here, working on the calf muscle, working over the knees, working on your ankles, these sides, everything. This one stretch is enough. All the pressure points activated, all the muscles gets activated, and it also addresses the psychological issues behind the knee stiffness or knee pain also. Okay, you can practice this asana any point of the time, at least again 2 hours gap between your heavy meal. You can even practice it at the bedtime to ensure you're having a good sleep. Okay, so still more stretches are there, but these stretches and mudras are important. Okay, first you practice these things. If you feel like learning some more stretches relating to that, some more mudras relating to this, then I can guide you at that time. First you practice these things. Okay, see the difference and you can get back to me and you just tell me how free your knee is after regularly practicing these kind of stretches and mudras. Okay. Closing prayer. Oh, உள்ளம் பெருங்கோயில் உன் உடம்பாலயம் வள்ளல் பிரானார்க்கு வாய்கோபுரம் தெள்ளத் தெளிந்தார்க்கு ஜீவன் சிவலிங்கம் கள்ளக்குளன் காலாமணி விளக்கில் ஓ Thank you. Thank you, friends.
Thank you, Maithili.
Thank you, Chandrakla.
Thank you, ma'am.
Bye, Maithili.
Thanks,
Ma'am.
Maithili.
Bye bye.
Maithili.
Bye bye.
Bye.
Thank you.
Thank you.
Thank
Thank
you,
you, Maithili.
Thank you, sir.
Thank you.
Thank you, Chairman.
Thanks,
Thank you,
Maithili.
Chandra.
Thanks, ma'am.
Thanks, sir.
Thank you, ma'am. Thank you.
Thank you,
Thank you.
sir.
Bye, Maithili.
Bye,
Bye,
Maithili.
bye, bye.